Hello friends, I am Dr. Manish Sharma. I am cancer specialist at Rajiv Gandhi Cancer Institute and Research Center, 𝐂𝐨𝐬 𝐂𝐨𝐧, South Delhi. All over the world, March is observed as a colorectal cancer awareness month. As per Globocon 2020, colorectal cancers are amongst second most common cause of cancer in women and third most common cause of cancer in males. And hence it becomes imperative to discuss about the causes, risk factor, symptomatology and treatment of colorectal cancer in today. So colorectal cancers are mainly sporadic in nature. When I say sporadic, it means that we don't find the cause of colorectal cancer, and few other colorectal cancers, they are hereditary in nature. When I say hereditary, hereditary means that the cancer has come from the parents because of the problem in some of the genes, that is at the DNA level. The example of such a syndrome is Lynch syndrome, in which the colorectal cancer occurs at early age in the patient's life. Other risk factors for colorectal cancers are smoked tobacco, excessive alcohol intake, excessive red meat or processed meat intake, and obesity. So once we know the risk factors of colorectal cancers, we should also know what are the symptoms of colorectal cancers. So colorectal cancers can present in three different fashions. So they can present asymptomatically, that is routine finding on the colonoscopy. They can sometimes present with the emergent situation such as obstruction of GI tract, and hence the patient can present in emergency department. Other than that, the other signs and symptoms of colorectal cancers are recent onset of change in bowel habit, that is recent onset of constipation or diarrhea, recent onset of anemia leading to the fatigue, abdominal pain, any abdominal mass. Similarly, the rectal cancers, they present with pain in the rectal area, bleeding in the stools, and the narrowed caliber of the stools. The left side of the colon and the right side of the colon present with a different kind of symptoms. So right side of the colon cancer patients present with anemia and bleeding, while the more of the left side of the patients, left side colorectal cancer patients present with more of obstructions. So once the patient or the person presents with such a symptoms and signs in our OPD, we try to investigate the cause for that. So to establish the cause, we need to do a colonoscopy. Colonoscopy is basically a flexible tube with a camera at the tip, and it is inserted from the rectum, and whole of the colon is visualized. Once we visualize the colon, any of the mass or any of the abnormal area in the colon is biopsied, and the biopsy is seen under microscope. Once the diagnosis of colorectal cancers is established by the biopsy, we try to stage the tumor. So stage means that how far the tumor has spread beyond colon and rectum. So to stage the tumor, we do a contrast CT scan of chest and abdomen, or alternatively we can do a PET CT scan of whole body. So the stage 1 and stage 2 means that colorectal cancers, they have not spread to the nodes, while the stage 3 means that the colorectal cancer has spread to the nodes. Stage 4 means that colorectal cancer has gone beyond their boundaries, and they have gone to the distant organs such as liver or lung. So once we have established the diagnosis of colorectal cancer, once we have established the stage of the colorectal cancer, now comes the treatment. So early stage cancers, that is stage 1 to stage 3, are treated with surgery followed by full 6 months chemotherapy in high risk patients, while the few patients who are low risk patients, they can be treated with the 3 months of chemotherapy, or alternatively few of the patients, they can escape chemotherapy as well. Similarly, the rectal cancers, if we talk about rectal cancer, the treatment remains the same, that is the surgery and chemotherapy. But in addition to surgery and chemotherapy, the rectal cancer patients need the radiation treatment as well. Once the treatment by surgery or chemotherapy is complete, all the patients, they have to be on follow-up scans and follow-up imagings for at least for 5 years. Talking about stage 4 colorectal cancer. Stage 4 colorectal cancer, the treatment options are chemotherapy and targeted therapy. So what kind of targeted therapy we are going to use would largely depend upon the sidedness of the tumor, that is whether the tumor is left-sided or whether the tumor is right-sided. And apart from the sidedness, the mutational type also determines what kind of targeted therapy we are going to use for our patients. Even though it is a stage 4 tumor, but few of the patients, they are eligible for surgery and long-term survival even in stage 4. So no talk would be complete if we don't talk about the screening protocols of colorectal cancer. So screening is done in the people who don't have any sign and symptoms. That is, it is done in the asymptomatic person. And the colorectal cancer are the cancer in which the screening protocols are well established and the programs, they are well established. So colorectal cancers are screened with the help of colonoscopy, and for an average risk individual, it should start at the age of 50 years every 5 yearly till the age of 75 years. Apart from colonoscopy, other options are to do a CT colonography or to do fecal occult blood testing. If we do the screening procedures, the colorectal cancers, they are detected early, and early detection leads to the complete cure of the patients. Thank you.